Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics today, including medical monopolies. Excuse me, before we get to that, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is the text for today's video. In that newsletter, you'll find all of the hyperlinks to every news article and medical journal and any actions. They're all in there. In addition, there's a long list of references for medical assistance, like if you need abortion or reproductive health care information, if you need to know how to contest a denied claim, and there are a number of organizational links to groups that fight for universal health care. So let's get started. The first item I want to present to you, and the link for this is in the newsletter and is really cool. The Kaiser Family Foundation just put out a really interesting website. There is an alphabetical list of U.S. states, and when you click on a state of interest, you're taken to a web page that summarizes healthcare for that whole state. They have the percentage of people in medical debt, the percent of how many people have Medicaid, how many are on Medicare, how many are on what percentage are on ACA plans. They have interesting data about reproductive health issues, chronic health statistics, just lots of cool stuff they put together state by state. So you might want to flip through and have a look at how your state does. Let's talk about hospital monopolies, because that's an area that doesn't get a lot of attention. National health spending totaled $4.5 trillion in 2022. That is 17% of the gross domestic product of the United States. And it's projected to grow faster than the GDP all the way through 2032, contributing to higher costs for families, employers, states, and the federal government. Now, keep in mind that as a percentage of GDP, our industrialized peer nations run between 8 and 10%. That includes countries like Germany, France, Japan. Now, one way we have seen that health networks keep prices high is by eliminating competition. Periodically, we run into news stories about the Federal Trade Commission suing to halt mergers because competition is removed and prices will unfairly rise. There is an example a few weeks ago where the FTC blocked Novant Health's acquisition of 2 hospitals because it would restrict competition in North Carolina. But is it a big problem? Well, it turns out, according to the Kaiser Family Foundation, the answer is yeah, it is. Nearly a third of all health spending goes towards hospital care. Consolidation of hospitals may allow providers to operate more efficiently. It generally doesn't. Usually what happens is they squeeze money out and keep it. Anyway, and it could help some struggling hospitals keep their doors open, maybe in underserved areas, but it does reduce competition. And a substantial body of evidence has found that consolidation actually really contributes to higher prices. Now, keep in mind that when private equity or commercial companies buy hospitals, quality seems to suffer. And when I say quality, that is, there are increased infections that patients suffer in the hospital, and they actually get hurt in the hospital, often due to lack of supervision, because one of the ways hospitals save money is by cutting back on staffing. So there are fewer people actually watching patients, like the ones who get up and say, I'm going to the bathroom, and then they fall face forward. Anyway, the Kaiser Family Foundation reviewed, get this, 387 metropolitan areas in the United States, and they found 1 or 2 health systems controlled the entire market for inpatient hospital care in nearly half of the metropolitan areas in 2022. And in more than 4 of 5 metropolitan areas, 82% of them, one or two health systems controlled more than 75% of the market. I include a graph of all of this stuff in the newsletter. You can go and have a look at that. I think we need to encourage the Federal Trade Commission to be a little more aggressive when competition gets limited. So here's an action that we can all take. I have a link to a click to send email, and it's in the newsletter, and I will try to put it in the YouTube description box as well. It goes to Lena Khan for her work as chairman of the FTC. All it does is thank her for the work she and her team has done, increasing competition and patient safety so far, and please make sure that she continues this aggressively. Now, in the email, if you choose to send it, down at the very bottom, there's a little place in brackets for your name. Put your name in there. And for your city and state, put your city and state in there. I want to talk also today about regressives and healthcare. I don't call them Republicans anymore. They're regressives. J.D. Vance, the senator from Ohio and vice presidential candidate that was foisted on Trump by billionaire Peter Thiel, is proposing substantial changes to the Affordable Care Act health insurance coverage that could lead to elimination of the ACA's protection against insurers levying higher premiums on individuals in poor health. Vance has spoken of deregulating the insurance market so that people can choose a plan that makes sense for them. You know, this freedom of choice is just crap. Anyway, on the campaign trail in North Carolina last month, for instance, Vance suggested getting rid of the ACA's single risk pool, which enables community rating, and introducing separate risk pools for people with chronic health conditions. That would essentially get rid of their insurance or make it just unaffordable. This would disrupt one of the ACA's guiding principles, which states that health insurers may not charge people higher premiums based on health status. That's why you want the big risk pool. If you have a small risk pool with people who are going to be high value claims people, their insurance becomes unaffordable. Anyway, I'm tired of people being conned into situations that are dangerous medically and financially in the name of so-called freedom of choice. Remember that Trump's view of improving healthcare was getting rid of the mandate to have health insurance and then allowing people to purchase very high deductible catastrophic health plans instead of normal health insurance. The result of that is frequently medical bankruptcy because the co-pays are so high, $15,000 to $20,000, $25,000 before insurance kicks in. Anyway, regressives favor also an abortion ban nationally. I want you to consider Vance's comments made during his debate with Governor Walz about a minimum national standard, as well as his call last year for the federal government to cut off all access to mifepristone, the drug used in more than 2/3 of abortions nationwide, using the more than 150-year-old Comstock Act. The Comstock Act would, enforcing that, could be done without Congress. Let me also point out, I'm going off the script here, in addition to not allowing medical abortion medications sent through the U.S. mail, the Comstock Act would prohibit materials and medical supplies that could be used in an abortion, but are often used for things like miscarriage management. It would prevent them from being sent to doctors and hospitals as well. What a charming behavior. Anyway, here's an action you can take. Vote accordingly, up and down the ballot. Up and down the ballot on November 5th or earlier, and make sure that this stuff doesn't go forward. That's what I've got for you today. Down below, you can like, share, subscribe, send me comments, send me subjects you'd like researched. You can also contact me by email at healthcareadvocacy1, all one word, @gmail.com. Thank you.